You hear a lot about people don't want to work weekends and people don't want to work nights, but actually, I won't say how many years ago, but a few years ago when my family were young, actually working weekends and working late in the evening is actually a lifestyle choice, because you have young children and your husband's working during the day, and actually working out of hours and working weekends is not a chore. It's a lifestyle choice. There are lots of people out there that actually do want to do it. Very good nurses, very good doctors that actually choose to do those hours. So it's helpful, you know, and the teams that work out of hours, they are absolutely focused on making everything as good as it is in hours, and that's part of what they want to do. They want to make it the best that they can make it. And they're a smaller team, but I think because they're a small team, they really support each other and they cover their colleagues. So from a small team, if I get somebody that is unwell and sick themselves, they're very much into, well, I phoned round and so-and-so is going to cover me. I've come from an emergency department background and worked there prior to working in the Acute Medical Unit. And I can tell you how difficult it is to move patients through the different departments once it gets to 6 o'clock. And as a nurse there, we can say, well, that stopped, so we do that ourselves now, or that service has stopped, so we have to do that ourselves now, and therefore everything slows. Whereas that's not true now. Those services are still working, and they're working towards they're not just picking up sick patients, they're picking up patients that they know are going home tomorrow. But actually, if they just had that blood test, if they just had one more x-ray, if they just had one more dose of, then actually those patients can get that. And then when the teams come in the next morning, they're ready to go. So we can discharge them earlier. So the Acute Medical Unit get the beds downstream earlier, which means the emergency department get into medicine earlier. And so the whole system works. It's not just about sick patients, it's about all the patients.
And therein lies the difficulty of the implementation of 7-day services, because where does emergency care stop? The boundary, once you're an inpatient, is impossible to draw the way we've set up services in most acute hospitals. So if we really truly want to support emergency care, we've got to have a background of routine activity running.